In this video, we are going to discuss about alcohol and diabetes mellitus. Is that alcohol is good for a diabetes patient or not, and how much is good and how much is bad for a diabetes patient? Then if it is alcohol consumption is allowed, which alcohol is better for diabetes patient? Such things we are going to discuss in this video. So, moderate alcohol consumption may have some health benefits. So, the research has been endorsed that moderate alcohol consumption only having some health benefits. Up to 1 drink per day for women and 2 drinks per day for men may have some health benefits like lower the risk of developing type 2 diabetes and improve insulin sensitivity. However, drinking more alcohol may cause the following difficulties. The number one problem is alcohol can affect the blood sugar levels. Consuming alcohol can cause blood sugar level either drop too low, that is called hypoglycemia, or rise too high, that is called hyperglycemia, depending on the amount of consumed and other factors. So it's important to monitor the blood sugar level closely and consume alcohol in moderation, ideally with a meal or snack. Alcohol can interact with diabetes medications. For example, the alcohol medications like sulfonylureas like metformin, glimepiride, glycoside, and insulin also can interact with the alcohol. So when you take the both drug as well as alcohol may increase the risk of hypoglycemia. That means the blood glucose level may drop down. Then third problem is with the alcohol is it may contribute the weight gain. So normally alcohol like wine, beer and all having high calories and sugar. So this consuming the alcohol in excess or more amount can contribute to weight gain and worsen diabetes control. Overall, the alcohol can have a negative effects on overall health. So drinking alcohol in excess can increase the risk of range of health issues such as liver diseases, heart diseases and certain types of cancers. Next is when it comes to managing diabetes, it's important to consider the impact of different alcoholic beverages like beer or wine or gin or gin. Which one do you prefer? Which one is better for diabetic patient? That is also we need to consider. Let us see. Here is the comparison of rum, gin, brandy, wine and beer. First one is rum. Rum is distilled spirit made from the sugarcane. Rum does not contain any carbohydrates or sugar, which means the rum has no effect on blood sugar levels. However, it's important to consume rum in moderation as excess alcohol consumption can have a negative effects on overall health. Next is gin. Gin is also distilled spirit that is typically made from juniper berries and other botanicals. Like rum, it does not contain carbohydrates or sugar and rum has no effect on blood sugar levels. However, it's important to consume gin in moderation and avoid sugary mixtures as these can contribute to high blood sugar levels. Third one is brandy. Brandy is a distilled spirit made from fermented fruit juice. Brandy typically does not contain sugar or carbohydrates, although some varieties may be sweetened. In general, brandy is a low carbohydrate and low sugar option for the people with diabetes, but it's important to consume in moderation. Watch out for added sugars. Next one is wine. Wine is made from fermented grapes and contains carbohydrates and sugar, which means it can raise the blood sugar levels. However, the amount of carbohydrate and sugar in wine varies depending on the type and sweetness of the wine. Dry, red and white wines tend to have a lower amount of sugar and carbohydrates compared to the sweet wines, and fortified wines like port and cherry. Finally, beer. Beer is made from grains and contains carbohydrate and sugar, which means it can raise the blood sugar levels. The amount of carbohydrates and sugars in beer varies depending on the type and the brand. But in general, light beers and low carbohydrate beers are better option for the people with diabetes. So in summary, spirits like rum, gin and brandy, these three are low carbohydrate and low sugar options for people with diabetes. But it is important to consume them in moderation and watch out for the added sugars. So at the end of the video, I am not recommending the alcohol consumption by diabetic patient or normal human being. So in general, alcohol is bad for our health. But exceptionally, if diabetes patient won't drink the alcohol, it's better to go with rum or gin or brandy. Wine and beer having the carbohydrate levels as we noticed. So it's better to go with the brandy or wine or gin. That is also in very low quantity along with the meal or snacks. So it may reduce the blood sugar level sometimes it may increase the blood sugar level. So we need to drink the wine and gin or alcohol very cautiously, otherwise better to avoid the alcohol by the diabetes patients. Thank you very much for watching the video. If you like the content, please do subscribe my channel.